Hi, everybody. Thank you so much for joining us today. Good morning, good afternoon, good evening. Thank you so much for joining us from whichever part of the world you're joining us from. I'm going to hand over to our moderator, Dr. Astor, to take us through the session. Astor, over to you.
Thank you, Esther. Thank you very much. So, hello, everyone, and welcome. Please note that welcome today for the PAF MNCH regional webinar focusing on the tools for advancing maternal, newborn, and child health, MNCH, advocacy and accountability at country, regional, and global levels. Please note that there is an option of interpretation of today's session in French. If French is your preferred language, please click on the globe icon in the toolbar at the bottom of your screen and select your preferred language. This is the second series of webinars, and I am delighted to be moderating it. I'm Dr. Badiane Ndeye Astou. I am currently the interim West Africa Hub and Senegal Country Program Director. And as a public health specialist, I've been coordinating various public health programs on HIV/AIDS, on IMCI, on disease surveillance. And currently, I am leading the respiratory care work in Senegal, collaborating with MOH to improve oxygen availability and utilization in Senegal, supporting also malaria pediatrics vaccines and pediatric praziquantel rollout in Senegal. So as we are studied, I would love for you to add in the chat where you are joining from and which entities you are representing. We have representation from government, development partners, donors, and members of the civil society from all over the world. I want to thank you all for being there and for all that you do for our women, children, and communities in general throughout Africa and beyond. We hope that through this meeting, we can network, exchange knowledge, and learn from others in advancing MNCH advocacy at the country, regional, and global level. Next slide, please. For those who are not familiar with PAF, next slide. We are more than 1,500 experts and thought leaders from around the world, from dozens of specialties, including product development, from contraceptive, rapid diagnostic, and other devices. We are also working on primary health care with people-centered health services and system strengthening. We are working on vaccines and essential medicines, starting from the development, formulation, manufacturing, and rollout. We are supporting digital transformation from electronic immunization, registries, and others real-time systems. We are working on epidemic preparedness and response, from disease surveillance, responder training, and coordination. And last but not least, we are working on advocacy and communication, elevating community priorities, influencing local and global stakeholders. A slide, please. Okay, so let me provide the framing of this conversation. As the world approaches critical milestone in global health, there is an urgent need to accelerate progress toward achieving the targets for maternal, newborn, and child health MNCH. This acceleration requires the fulfillment of policy and financial commitments to drive substantial improvements in MNCH outcomes from the subnational to the global level. Despite numerous commitments made by countries to improve MNCH, progress remains uneven. To meet global targets, it is essential to ensure that all commitments, whether policy or financial, are fully realized. A key challenge lies in effectively tracking these commitments and translating them into actionable outcomes. Data on MNCH is generated at various levels, but there is often a lack of clear tools to monitor and measure progress against the commitments made. This webinar aims to address the need for effective advocacy and accountability tools to advance MNCH at both country and global levels. By providing participants with the necessary tools and strategies, we seek to empower advocates to drive meaningful change and hold stakeholders accountable for their commitment. Could I have the next slide, please? Related to the session objectives, which are to expand the capacity of participants in interacting and utilizing different types of tools for MNCH-related advocacy and accountability. We want to gain familiarity also with new set of tools that can be used for advancing accountability and advocacy at country, regional, and global level. We want to strengthen alignment on advocacy priorities and coordination on MNCH advocacy partners towards improved MNCH outcomes at regional level. Next slide, please. And the expected outcomes of this meeting is to enhance understanding of the tools available from MNCH advocacy and accountability, to increase capacity to track and measure progress on MNCH commitments, strengthen networks among MNCH advocates at regional level, concrete action plan for advancing MNCH advocacy in participant respective context. Next slide, please. So I am pleased to introduce our speakers for today's session. I am introducing Ilse Kalnina, which will talk. She is a partner engagement and global events lead, working from the Partnership for Maternal, Newborn and Child Health, PMNCH, and she will talk about collaborative advocacy action plan initiative. So Yilzi, the floor is yours. Over to you. You have 15 minutes. And after that, we'll go to the discussion, the Q&A. Over to you, Ilse.
Thank you very much. I will be able to start sharing the screen when maybe this slide is coming down. Thank you so much. And thank you so much, Dr. Astu. And it is a true privilege and honor to be part of this webinar today and discuss how together we can advance the maternal, newborn and child health, advocacy and accountability. And so my name is Ilse Kalnina. I'm working from the Partnership for Maternal, Newborn and Child Health. And it was nice to hear, Dr. Astu, that PATH is 1,500 experts strong. Also, the partnership is more than 1,500 organizations strong, working across the world on the issues of women's, children's, and adolescent health from the lens of strategic advocacy. And the way we work is really to build on the strength of the partners across the 10 constituencies, from the civil society, the healthcare professionals, funding agencies, adolescent and youth groups, partner governments, and others. And it was so nice while I was listening to the introductory remarks, seeing so many colleagues and friends noting that they have joined this webinar today. So the partnership, even though I will be speaking today, it's very much the work and the leadership of the partners. To set the context for the Collaborative Advocacy Action Plan Initiative, wanted to highlight that we do work on the 3 thematic priorities, and definitely maternal, newborn, and child health, including preventing the stillbirth, is a key area of our focus. And it's excellent that the community came together around the World Health Assembly and the new resolution was passed on advancing and accelerating efforts on MNCH. But here today, I will speak how we would like to assist the country efforts led by our country partners. So in terms of the expected outcomes for our advocacy efforts, we are focusing on ensuring that there are better policies in place, how the financing could be increased, but also better used, because we all know that especially now in these difficult times of the poly crisis, to see how we can more be effective and using that more smartly. And then ultimately, how we can jointly improve the access and availability of the services for the women, children, and adolescents, and especially those most marginalized. On the Collaborative Advocacy Action Plan initiative, and here I see I'm honored that I'm sharing the virtual stage with Dr. Aminu Garba, who is one of the champions and leaders of this initiative, and also PATH colleagues are so much engaged in this work, and others who are in audience. When we discussed at our board and what we were hearing from our partners is that indeed, as also Dr. Astu said, that there are a lot of commitments, but what we are seeing that the women's and children's and adolescent health, and in particular maternal, newborn, and child health, is at a serious risk if we don't come together. And where the efforts are most needed to be supportive is at the country level and along the priorities which are the best for the country context and for the communities we are serving. So that's a little bit of the background for the initiative, and to say that it was starting last year, and we are co-creating this initiative with our partners. And actually, the actual collaborative advocacy action plans, the first ones will be finalized soon. And again, Dr. Garba is the leader and champion on that specific plan. When we are talking about the Collaborative Advocacy Action Plan initiative, there are 3 main elements how we are approaching it. The first one is around convening and strengthening the stakeholder engagement. And very much what was discussed in the last webinar series to see how the partners could more collaborate. Here, the intent is, and we are engaging with the civil society partner in each of the countries who is then leading and guiding and coordinating these activities. The second part of it is to see which existing multi-stakeholder platforms could be used for this initiative and strengthen to really broaden the participation and bring more community groups to the table. The third element, very importantly, is not to create anything, but see how more the synergies could be strengthened with other initiatives which are already happening in the country, including the ENAP, EPPM, and others. And the fourth element, I will just highlight a little bit because that will be part of the next webinar series, is about the digital advocacy hubs to extend the engagement. And what we mean here is to see how more partners could be brought around these efforts and initiatives, and also some communities which may not necessarily be so available otherwise. The second part of it is gathering and sharing evidence. What we have heard from the partners is that there are many commitments which have been made, but not necessarily always they are visible, and again, to everyone. So the efforts that are being made to compile these commitments on the women's, children's, and adolescent health and MNCH to see how the whole spectrum looks like. Where are the commitments and where maybe there are some of the gaps, and also look at the implementation. Because what we have seen is that the commitments may be very good and put in place, but indeed where the action is needed is on the implementation and what exactly the support is or the gap is needed. Then final part of it is the collaborative advocacy action plans themselves. Again, going back to the previous webinar, in the Mentimeter, it was said we are trying to do too much. We need to clear priorities and not to try to do all at once. That's also what we are trying to do with this initiative, is to see what would be the limited set of key priorities in the specific countries we could all rally around then and implement. And looking at implementation could be linked to accountability mechanisms and seeing what is working, where we need some additional support or the strengthening, and what are the lessons learned. In terms of the engagement principles, we as a PMNCH, we very much are guided by the leadership role of the country partners, our country coordinating partners, as well as the engagements with the Ministry of Health and other partners in the countries, because they would know the best, like what and how and when would be the possible and most feasible. The second principle is to see how we could support more inclusive and meaningful participation and engagement of different country stakeholders. And here, looking if some of the groups are not necessarily included yet, such as the adolescent and youth groups or some healthcare professional groups. I was seeing and very happy to see a number on the call also today, or community groups, to better understand like what are some of the bottlenecks and challenges, so that these could be engaged and be listened to and learned from. Principle is leverage and strengthen existing national multi-stakeholder and partner mechanisms. So that again, to looking at the sustainability and how then this could be supported in the longer term. And the fourth principle is to see how we can make also the process and the communications and this evidence more available and transparent for different partners whom we know already, but also the new partners joining. And looking at the principle for the mutual accountability, to seeing what role each of the partners could play and support. This slide provides a little bit of a process, because in this initiative, indeed, in preparation for the plan itself, we do believe the process is extremely important. And also it's why when I will speak later in which countries we engage, there are different stages where we are working with different partners in different countries, be guided by them. It's why we are very grateful for the partners who have undertaken these roles, because this is enormous effort from their side, which they are championing and leading and putting countless hours and efforts thinking how we can all be advocating with one voice on specific key issues to really advance and accelerate the progress. The second is also around the mobilizing the in-country partners. And that's why even there is a lead partner, then of course the partners are being joined by other stakeholders in the country at different stages of the process. And ultimately, indeed, at the end, we would like everyone to support the priority advocacy asks. The third step is like what I discussed about the bringing commitments in one place, so that everyone has this information available. And then looking at these commitments and looking at the status, seeing what would be these key priority advocacy goals if to put in place so that everyone can rally around the same goals. This slide very briefly is outlining in which countries we have started the Collaborative Advocacy Action Plan initiative. And as you can see, mainly these are in Sub-Saharan Africa. And we are grateful for the partners who have put their hand up and are leading these efforts across the 10 different countries in Africa. And then then advancing, as I mentioned, in the different stages. But again, it will be so interesting and grateful for your inputs and ideas, because we are starting this process and very much being guided by experience and learnings, and how best also from the global level we can support these efforts. Let me now focus a little bit on the Collaborative Advocacy Action Plan itself. And here I need to say that we have not yet finalized one completely. The first one will be in Nigeria, and Dr. Garba Aminu Garba, who is on the call today, is championing and leading with Africa Health Budget Network this work. But in the advocacy plan, what the expectation is indeed to see which are some of the key advocacy goals which would be catalytic to advance the long-term financing service delivery outcomes, policy outcomes, and where these could be supported by joint advocacy efforts. And again, this is looking from the PMNCH side at the 3 thematic areas, but MNCH, of course, is a very key part of this. What would be identified in this Collaborative Advocacy Action Plan is, of course, these key advocacy goals, a select prioritized goals by the country partners, which activities that need to be undertaken to achieve that advocacy goal, what are some of the target audiences and who would need to be engaged to successfully complete it, and then also some timelines and milestones and resources needed to give that little bit of the pressure and the urgency, and also see and align, again, very limited resources and people's time as well, aligning advocacy around the same timelines and the milestones, and seeing and checking in like what could be done on the way of achieving these goals. So that would be the expectation of the plan. And then when these plans are finalized, then again, it would be excellent if all of the partners, those who are already working in the space or could provide the support to enable and implement these activities, then that would be the tool to see what are the country priorities, what already partners are aligning their efforts against, and then how new partners and other partners can be supporting these efforts. It is how then also that is communicated, and also how then different organizations and communities and partners could be also aware of the efforts and all this work. And in
Excuse me, Ilse, yeah? We have 1 minute left.
Okay. Yes, because this is just a summary slide to say that in these digital advocacy hubs, which will be discussed the next session, we will be putting together all the evidence and information, again, asking country partners to share their best practices and country material, then seeing who else is working on the same or similar initiatives and the topics, and then around the activities and the action, how these activities could be best aligned and supported. With that, indeed, I'm thanking you for your time and very keen to hear your questions and support in our joint efforts. Over from my side.
Thank you so much, Ilse, for this very detailed and interesting presentation. Now it is our Q&A sessions. I will start with mine. For organizations that have active country-level advocacy, how can we ensure we are involved in and included in CAP plans? How can we make global commitments meaningful at country level? For participants, feel free to raise hand or to put your question in the chat box. Thank you.
Okay, thank you so much, Dr. Astu. Should I now answer to this question, or should I see if there are any others?
I think that we could start with this question, And
Okay.
we could check in the chat box if we have others. Thank you so much.
Yeah, thank you so much. And also, if Dr. Minu, you would like to compliment, please feel free to do so, because you are one of our CAP lead partners in the country. But in principle, the engagement and participation could be at different levels, also at the different times of the process. Because in some of the countries, the process is just slowly starting, and in other countries it's much more advanced. So, for example, when ultimately these country collaborative action plans are finalized and are communicated, then it is very clear on specific priorities that with specific timelines and the deadlines where all the partners could then connect with a specific organization leading around that advocacy goal and see what support they can provide, what information and what advice they could give into achieve that advocacy goal. But before that, as well, as I mentioned, we are opening these digital advocacy platforms, and actually in Nigeria, and we can also put the link in, there are more than 150, I think, partners are already on the hub. Then that provides an ability also to share from the partners if there are some good case studies and suggestions how to advance the advocacy. Sharing this information also on when, for example, there are different opportunities for the civil society to share their input and feedback and lived experience when they are being part of the, say, the review of some national policies and practices. Also, if there is either the parliamentary hearing or some other accountability activity happening, to see how they could also participate in these. So it would really a little bit depend on in which stage the activity is for the different countries, but we would be very happy if it is the question on specific countries, if you reach out to us and we would provide a little bit more detailed guidance on that. But I don't know, Dr. Garba, if you would like to complement as well.
Ilse, I saw another question in the chat booth. How does evaluation of the effectiveness of partners' participation is done? It is from Risha Katanji.
Yes, that's an excellent question, Richard. As I mentioned, we have just started, I would say, this initiative. So we will be looking at the evaluation of the effectiveness of the partner participation in some time when the caps are being finalized and when the different partners are being engaged in these advocacy efforts, seeing what is working, what could be done slightly different, and how we could be better supporting these efforts. So that's definitely planned in some time, but not yet.
Okay, the last question before moving to the next speaker. What does it take to belong and participate in the collaborative advocacy action plan?
To participate and support the advocacy goals, which are part of the collaborative advocacy action plan, would be then when these specific organizations, country-level organizations, are identified, which will be coordinating the specific activities, then that would be to liaise with these partners and see what exactly the specific organizations could contribute to these efforts. So it would really depend on the case-on-a-case basis. And this is why we thought that with the digital platform, allowing that information to come in, and then also stating like what the interest is and where some gaps are, where some additional partner support would be needed, could be very helpful. And also from the other side, we do expect that this would be very helpful also for the donor community to see what the country partners have identified as priorities, and then providing additional funding for these country and country organization-led advocacy priorities. That's over from my side.
Thank you so much, Ilse. I cannot see it from here, but do we have some hands that are raised? Some participant that would like to ask some question before moving to the next panelist? Or you could continue, or we could invite them to put their question in the chat box so that you could continue to exchange with them while the other panelist would make his presentation to make sure that we'll stick to time. Are you okay with that?
Yes, thank you so much. And absolutely, I will be watching the chat and responding.
Okay.
Right.
Yes, thank you so much, Ilse. Thank you. So I'm glad to introduce Dr. Aminou Magashi, who is the CEO of Africa Health Budget Network. Dr. Aminou Magashi Garba, with over 25 years experience in development work, is the founder, coordinator, and CEO of the Africa Health Budget Network that uses budget advocacy to influence adequate and efficient health spending and investment that's improved transparency and accountability for health sector in Africa. He is a member of the Global Health Security Agenda Sustainable Financing Preparedness Action Package and the global co-convener of the Community of Practitioners on Accountability and Social Action in Health, COPASA, and currently hosting its global secretariat in Abuja, Nigeria. Dr. Aminou served as the civil society representative for the Global Financing Facility GFF investor groups in 2017-2018. He is a member of the board of champion of the Partnership for Maternal, Newborn and Child Health, PMNCH, hosted by WHO Geneva, the largest global multi-stakeholder and multi-sectoral network supporting women, children, and adolescent health. He holds an MBBS degree from University of Maiduguri, Nigeria, and a Master of Science in Public Health and postgraduate diploma from London School of Hygiene and Tropical Medicine in 26-27, and a 26-27 British Chevening Scholar. So Dr. Aminou, the floor is yours for 15 minutes. Thank you so much.
Okay, thank you very much, the moderator. Should I send my screen or you'll be sharing from your end?
You can share your screen, Dr. Aminou. You can share the screen.
Okay, all right. Okay, I'll off the camera to give me a stronger network while sharing my screen. Thank you very much. Okay, hope you can see the screen.
Yes, it's okay.
All right, thank you. So let me appreciate the leadership of PATS for convening this webinar, and to also welcome all the esteemed participants that joined this conversation, over 100 people across the globe. I will spend the 10 minutes to make my presentation and maybe use
Dr.
the
Dr. Aminou,
5 minutes.
could you put it in slideshow, please?
Okay, let me check. Is it good now?
Perfect. Thank you.
All right. Okay. So I will spend the first 10 minutes around the presentation, then the remaining 5 minutes to respond to question. And so we're trying to look at the tools in tracking MNCH financial and non-financial commitments made at both country and global level to ensure accountability and progress. And we heard from Elise of the partnership. She looked at the collaborative advocacy action plan to narrow down to a specific tool that we are using to promote accountability, which is the scorecard. Accountability has different definition, but more or less is the same, everywhere. It's the obligation to explain actions, accept responsibility, and disclose results transparently, ensuring parties are answerable for performance and adherence to standard. Any accountability definition is the same. It's about monitoring, reviewing, and using the review to take remedial action and hold the duty bearer to account. So this is how the UN also define accountability. It's about reviewing and taking remedial action based on the findings. So a scorecard is an example of a tool that is being used to promote accountability for MNCH financial and non-financial commitment. A scorecard is a performance measurement tool that tracks and display key metrics and indicators, allowing organizations or individuals to assess progress towards a specific goal and objective. So, to give you some example of the global and the country MNCH financial commitments, all of this is just to refresh our mind. The family planning global financial commitment. Many of you are involved in the FP 2030 movement with a lot of family planning, both financial and non-financial commitment. I'll come to them as an example. The immunization global and country financial commitment, those engaged in the immunization space, they know about the Gavi and the government commitment to promote immunization, both financial and non-financial. The Global Forum for Adolescents, the GFA, which was also launched last year by the partnership at the UN events. It also has a lot of financial and non-financial commitment. Then also those engaged in nutrition space, the Global Nutrition also initiative has a lot of example of financial and non-financial commitment. Some of the non-financial commitment we can also see is within the EPMM architecture, ending preventable maternal mortality, and also ending the newborn action plan. There are a lot of indicators looking at access, coverage, demand creation, and services. So it just gives us a background. And what are we tracking with the scorecard? Just to give you an example. We are tracking budget for family planning. So those involved in the FP 2030, every country that's a member and also a commitment maker in the FP 2030 has agreed to certain family planning financial commitment. For example, a country will commit to allocate annually $4 million or $5 million or 10 million, depending on the strength of the country and also the capacity to provide money. And this kind of finances is packaged into a partnership with the UNFPA into a basket fund to procure family planning commodities. That is a very good example of a financial commitment. The budget for adolescent health through the GFA, for example, funding to promote youth and adolescent-friendly health services. Immunization budget, funding to procure vaccines, funding to support logistics, and also support distribution. Nutrition budget, for example, those who are familiar with the nutrition space, funding, accountable funding to ensure ready-to-use therapeutic food to support malnourished children. These are examples of the financial commitment that we are tracking using scorecard. Some of the example of the non-financial coordination, very key. So apart from the money, we also need to support coordination of the MNCH mechanism. Elizia has mentioned that within the CAP, there's an accountability mechanism. So for example, a particular country will have the multi-stakeholder partnership coordination forum. That is a coordination among donor partners, government, young people, development partners, and so many other non-financial commitment like transparency, access to information, both non-financial and financial information, promoting accountability, governance to deliver service, patient satisfaction at the facility level, and also the health facility services such as antenatal care, postnatal care, immunization, and so many other services. I want to give you an example of how a scorecard look like. Like for example, in Nigeria, this is a scorecard that's measured in 2022. The commitment to reproductive, maternal, newborn health plus nutrition accountability scorecard as part of the post-COVID and recovery. And we can see some example of indicators that we are tracking in Nigeria, looking at family planning budget, looking at the release of the family planning, nutrition budget, the adolescent and youth-friendly services budget, and also immunization budget, like I mentioned earlier, among the financial commitment. These are a very good example of financial commitment. But we can also measure accountability and transparency, which is the non-financial tracking system, to look at the participation of CSOs within the global and local accountability mechanism, young people to be at the table at country level, not only at the global, and also ensuring that roles and responsibility of different stakeholders are outlined in a written government document. And we can also look at services as part of non-financial access to immunization services, contraceptive prevalence rate. Is it increasing? Are we meeting our target or need of family planning? How many antenatal care visits is being made? These are all examples of the non-financial accountability. I want to run off the session by showing you some live pictures of using the budget to promote accountability and also track MNCH. This is a meeting where we are engaging the media, and I was describing to them the different level of the scorecard indicators in tracking the progress. And the second picture is showing the different stakeholders holding the scorecard and launching the scorecard in Abuja, Nigeria, by the National Advocate for Health. And another picture you are seeing, the person I'm showing him the scorecard is a member of parliamentarian at the chair health committee within the assembly. We are engaging and sharing the key finding of the scorecard so that the National Assembly can improve oversight function and track MNCH financial and non-financial commitment. This is holding the scorecard, engaging with the parliamentarian to promote solidarity for what the civil society are doing across Africa and Nigeria. So I will wrap up some of the session by looking at some challenges. It's not a rosy journey, engaging using the scorecard. Tracking for accountability and securing success, it could take a very longer time. So I want to inform the CSO in the room that it could take a very long time to actually secure success in using scorecard and also promoting accountability. Access to government information could be delayed or could be denied. So you have to do a lot of advocacy, collaborative advocacy, to really get government to provide data. Publishing scorecards could create tension between CSO and the government. If the scorecard does not favor government in terms of progress and success, and also achieving commitment locally and globally, when you publish scorecard, it can create a lot of tension. So we have to apply a lot of diplomacy to publish and also manage the relationship after publication. This is in summary my presentation, and I also look forward to questions before I wrap up this session. Thank you very much, and I will hand you back to the moderator. Over to you.
Thank you so much, Dr. Amino, for the quality of the content, but also for sticking up to the time. I have one question for you. Given the budget, Dr. Amino, is it okay?
You can proceed, please. Thank you.
Okay, thank you. Given that budget advocacy necessitates one to engage with political leadership, how can CSO partners maintain objectivity so that they are not influenced by the political forces and yet still achieve results? Thank you so much. Esther, do we have some hand raised up? Dr. Aminu,
Yes,
you could...
there's one hand that has been raised, and we have another question in the chat.
Okay, thank you so much. Dr. Aminu, over to you. Yeah, over to you.
Okay, so this is also one of the challenges of the card and also budget advocacy and promoting accountability to maintain objectivity while engaging with political actors and the duty bearers. The way to maintain objectivity is not to get too close to political actors, maintain an official relationship, but do not get too close to become so relaxed with them. So because if you become too friendly and also become too relaxed, you will not be able to maintain your objectivity. In fact, you cannot even publish the scorecard because some of the findings may not favor them. So the best way to maintain objectivity is to be factual in whatever you are saying, and also to maintain an official relationship without getting too personally close to a political actor. This has been the wisdom and also the strategy we have been applying in Nigeria and in Africa to maintain our independence and also our objectivity. Thank you, and over.
Thank you. For the participant which has his hand raised, you could go please with your question.
Thank you. My name is Chris Owala. I work for Community Initiative Action Group Kenya. I wanted to weigh on the issue of budget advocacy in health, or generally the scorecard, and it has been shared there, but I want to say that budget is both political and legal process. So yes, you need to stay firm, but for you to influence budget, you also need to identify the right allies, analyze your stakeholders well, so that you influence them at the right time. Then there's also what you call the opportunity, targeted opportunity, the opportunity that comes that you can use. But again, if you don't map your stakeholders well, and also use allies within the government, then at times you might have a good process which is legally binding, but is politically short-led. So it's good to tilt the balance, go with the legal process, but knowing very well that the budget is a political process. Thank you.
Thank you so much, Chris, for your comments and inputs on Dr. Aminu's presentation. We could go ahead with the second participant, which has his hand raised. Seems that we have no question left. So Dr. Aminu, thank you so much again. We have some questions in the chat box that you can respond to while the other panelist will make his presentation.
Okay, thank you very much.
Thank you. So I am honored and humbled to introduce the next speaker, which is Mrs. Wanjiku Manguyu. She is the Regional Advocacy and Policy Advisor at the PAF. She is an accomplished public health professional with over 12 years experience working in policy advocacy that impact the lives of women and children. She is currently responsible for the design and execution of initiatives to strengthen the capacity of PAF and its partners to engage in impactful advocacy, strengthen linkage between country programs, and facilitate opportunities for South-to-South collaboration and learning. She provides leadership for the design and delivery of policy advocacy capacity strengthening activities, including the development, adaptation, facilitation, and dissemination and application of PAF policy advocacy tools, frameworks, and curriculum. She supports advocacy engagement for PHC and RMNCAA at regional level and national level by generating, synthesizing, and collating resources, evidence, and tools. So Mrs. Wanjiku, the floor is yours for 15 minutes so that we could discuss about capital to clinic tool. Thank you so much. Over to you.
Great. Thank you so much. Just confirming that you can hear me.
Yes, we can.
Okay. I hope you can see my screen as well.
Yes.
Okay. Great. All right. So thank you, everybody. I think I will need to go off camera just for the purposes of the presentation. Thank you very much, everybody, for having me join this conversation. Really good to be able to participate and add into the discussion around the various tools available for maternal, newborn, and child health. And what I'm going to do is focus on a tool that PATH developed called Capital to Clinic. This is a resource that is really geared towards advocates and meant to help.
Excuse me, Wanjiku,
Sorry,
could you go
has my
to
screen gone?
Japorama? Yeah, Japorama mode, please.
I'm sorry?
Could you go to the presentation mode, please?
Oh, okay, sorry. Let me know if that comes back up. It's come back up?
Not yet. Yeah, I think that. No, not yet. Could you try again, please?
Yeah, let me go ahead and try again. I'm not sure why that's happening. In case this doesn't come up, I think Pascaline, if you can go ahead and beam it up from your end. I will stop sharing for now, just so that I can go ahead as that is coming back up. But just to give you a bit of background as that is coming back up, essentially what we did is we looked at policy implementation and some of the barriers and enablers for policy implementation and how advocates can, what the role of advocates is and how they can strengthen these processes. So essentially what I'm going to do today as that comes up is I am going to just give a little bit of background where I'll provide some of the thinking behind creating this tool. And then I will go ahead and talk a bit about what we found in terms of our process and the data and information that we gathered. I'll then go ahead and just very briefly describe the tool for you and share some of the key learnings that we have and the considerations. Okay, I'm just checking that this can come up. Okay, so as that is still coming up, sorry.
We can go ahead with what,
I'll just
what
go
you
ahead.
have so far. Yeah.
Yes, I'll just go ahead and as everyone knows that the presentation will be shared in addition to other resources. Okay, so once that comes back up, you can just jump right into the background and approach. So essentially, when we are looking at how advocates can support successful program and policy implementation, we are mindful of the fact that policies are only as effective as the extent to which they're implemented. So a lot of the time, we have a lot of action around the policy development processes, but then
Wanjiku, I think that even if we do not have it in presentation mode, you can still put your presentation. we will do is what we have.
Okay.
Just try to share it again for participants to follow up better.
Okay, I'll just, sorry, I had jumped off of there. Okay.
You closed that. Sorry.
Okay, so to the PATH team, I think you should be able to share it now. I will just go ahead, and that should be coming up in the next minute, hopefully. Apologies about that to the participants. So essentially what we were looking at is that we often have a lot of action around policy development and when it's adopted, but then that action, that enthusiasm sometimes falls off when we're looking at actual implementation. So what happens then is you have a result where some policies are either inadequately implemented, and this of course affects issues around access to health services, those on the ground. So what we were looking at is making sure, what do we need to do to make sure that every policy has a plan of action, it has resources, there's dissemination, and there's adaptation. What we are aware of is that we have a lot of policies that are, you know, that have sort of existing tools and frameworks that detail the policy implementation process. So we have those, but then most of those resources were created to guide the actions of decision makers or policy makers or program implementers. So we have less that are really geared and targeted towards advocates. Now, this is really important because when you think about it and looking at the whole policy process, development, implementation, if you reflect back to what Dr. Aminu just talked about in terms of accountability tools, you know that advocates play a really key role in driving the actual policy implementation. We act as, you know, we hold policy makers accountable. We are looking at effective policy dissemination. We're, you know, doing a lot of communication. So it's critical to have resources that would help advocates actually do this. If you can move to the next slide. Great. So what we did is we developed this resource, which we dubbed From Capital to Clinic. This is a resource that empowers advocates themselves to really have this, to drive program and policy implementation. The way we went about this, we convened a technical advisory group in late 2019. We conducted a very thorough literature review of specific policy implementation frameworks and the existing tools, some of which you can see on there, and some which, and a lot more that will be attached to this presentation. We then went ahead and did participatory and virtual consultative workshops where we pulled in various stakeholders. So we pulled in stakeholders, including policymakers, advocates, those who are actually providing health services on the ground, civil society, researchers, and donors and others. And we put them together to sort of come up with, first of all, looking at, okay, what are the actual bottlenecks to policy implementation? And what are ways that advocates and policy implementers can overcome them? And then the second thing is we looked at where does policy implementation, what are the best policy implementation and dissemination practices, and what are their implications for policy implementation? So the result of all of this work was, as you see on the screen there, Capital to Clinic, this resource. So this is a resource that will help advocates to catalyze action around policy implementation. And we also provided, we put our information together and provide a white paper that dives much deeper into the literature review, provides a few examples from countries in the region. If you can go on to the next slide. So just to give you a quick snapshot of what we found, I will give us a quick snapshot and you will have the opportunity to look deeper into this once you have the slides. But essentially, when we look at policy implementation, we asked ourselves several questions. Why is it that some policies are implemented better than others, even when they're being implemented in similar contexts? What are some of the barriers and what are some of the enablers for successful policy implementation? So what are the pieces that need to be there to ensure that policy implementation happens? We also looked at what are some of the contextual factors. So the environment in terms of, the communities you're working with, the complexity of the health problem that you're trying to address, and the policies associated with that health problem. And then we identified some key strategies that can be used to improve policy implementation. I think you can move on to the next slide. I'll be very brief about this. So essentially what we saw is that policy implementation has traditionally been categorized into two concepts, right? So top-down versus bottom-up. And when we're looking at top-down approaches, we're really looking at the design of the policy itself. So there are some assumptions that if you design a very good policy, if the policy is designed well, then it'll automatically happen that implementation will flow smoothly. Now, we know that's not always the case. We saw during the consultations, during the literature review, that this tends to happen or to suit well when you have, just a singular health problem. So it's very simple. It is something that can be applied across, a large population. There are not too many layers in terms of how to implement the policy. So if you think about examples like distribution of long-lasting bed nets, to prevent malaria, those sorts of things. But when you move on to the next slide, when we're looking at bottom up, when that's now different in terms of with these sorts of policies, things are really being driven from implementers. So communities, health providers who are providing services, civil society, so those who are working directly with the public, and they're really driving policy implementation. And this tends to happen when the problem is a little bit more complex. So for example, looking at broadly primary healthcare services, right? That's so PHC. So that is a much broader problem that you want to address that will likely have several layers and very many different stakeholders attached to it. So that just was to give you a bit of a flavor of what the thinking, what the literature showed us. So how that applies to what we developed onto the next slide. Essentially, we came up with this action checklist. So we recognize, and I like what Dr. Aminu just said in terms of, in response to one of the questions around the relationships between, advocates and policymakers. We recognize that a lot of the time we do actually need to put the guidance for both advocates and decision makers together to make it clearer in terms of how to proceed. If you move on to the next slide. I'll just focus on one or two things on the right side of your screen. So actions for advocates. We recognize that you have the full policy cycle, starting from policy, agenda setting to development of policy to adoption. Then you're looking at resource allocation and then implementation and evaluation. So with that first step where you're looking at agenda setting and building political will, some of the key things that we saw that advocates need to do is having very specific, clear advocacy strategies that have very clear objectives and include all those aspects such as, which decision makers you're working with, what are possible barriers to the policy implementation, who are you working with. You're also packaging and sharing information from the research that has guided this policy direction, and you're making sure that you're connecting with various stakeholders. The next slide. Now, around the policy development actions there, so where you're actually coming together, I think one of the things that has been very, very clear is the need for advocates to participate in these various working groups, but not just participate in terms of providing opinions, but then also contributing specific technical knowledge. We are the ones who are working with communities. We are hearing what is going on in terms of some of the challenges. So we want to be able to translate that into technical knowledge. I'll move on to the next slide. When we're looking at the policy adoption phase, this is where we want to ensure that there isn't an assumption that just because a policy has been developed, that it is actually going to be adopted. So this is one of the things as advocates we are very, very specific about in terms of ensuring that we have final, sign off and approval. This is adopted, whether it's at national level or subnational level. And then we make sure that this is shared out and that people are aware that this is the direction that the country is going in. So when we move on to the next slide, in terms of the next step, we're looking at issues around resource allocation. So what can advocates do when we're looking at that part of the policy cycle? As Dr. Aminu said before, we want to engage in the budget cycle, but not only engage in the budget cycle, we have to really be aware of where we can influence what decisions are being made. You have a clear budget cycle for all countries, national level, subnational level, but a lot of that work, the analysis to come up with recommendations, has to happen at certain times. So being mindful of that and making sure that that happens when recommendations can actually come on. The other thing I might want to emphasize here on resource allocation is really advocating for the development of a costed implementation plan that goes hand in hand with the policy. Sometimes that is done after. It's always ideal if it could happen at the same time, just to ensure that resources are actually allocated as and when the policy is being adopted. And then the other thing maybe to add on is just looking at strengthening the capacity of civil society to make sure that they are engaging in these financing and accountability processes that are linked to the budget making process. Next slide. So when we look at the policy implementation part, I think maybe one thing I want to really stress here is the third bullet, is educating local advocates, patient groups, community groups, media, and other stakeholders, so that they themselves are really understanding the policy implications and are engaging in the policy implementation in terms of if services are being provided, if the policies are being implemented as have been written down, and then are also engaging in issues around accountability in terms of quality and then being able to feedback to guide further future planning. I think also with this part, we want to make sure that, yes, I'll be wrapping up.
Excuse me. Yeah, could you wrap up, please? We have just 15 minutes left.
Sure.
Sorry,
so we want to build the capacity of coalitions to make sure that they can support the implementation of the policy. On the next slide, we're just looking at the monitoring and evaluation, and I've already mentioned some of that. So I would like us to go to just the very last slide where I share some of the considerations when using this resource. The main thing to think about here is that, and we stress this, a policy must be fit for purpose and must be fit for context. You need to look at what the health challenges are, what resources are required, and match that with the content in terms of how the policy will be implemented, funded, and utilized. The other thing is that policies vary very widely based on the complexity of the problem. So you don't want, you have to be cognizant of the fact that one policy implemented in one context might not fit in a different context. Inherently, policy development is a political process. We have to be alive to that, acknowledge that, and be aware of that to be most impactful, to be most effective. Approaches to policy implementation are usually top-down or bottom-up, but what we've also seen is sometimes you have, a lot of the time actually, you have a mix of the two, again, depending on the complexity of the health problem and the context. And then again, I think one of the things that I wanted to reiterate that we are now more familiar with is the lessons we learned from the pandemic. It has really just taught us that the process of policy development and implementation must be adaptable. It's only when you have adaptable policies, you have communities that are feeding in, that you are likely to have impact. So I can end there and invite anybody for questions. Thank you.
Thank you so much, Wanjiku. As we are running out of time, I will invite the participant to put their question in the chat box. Thank you so much. So thank you to all the panelists. Ilve introduced us the collaborative advocacy plan initiatives, which include many partners all over the world. Actually, it is a platform that will help to gather and generate some evidence. But above all, it is inclusive, and it is promoting actually a meaningful participation of the organization with the leadership of country partners because they know better than us the context. What I really appreciate is that they are leveraging existing partner mechanism to avoid duplicating efforts. Dr. Aminu went us through a scorecard that support to track financial but also non-financial commitment related to MNCH. However, he raised some challenges related to accountability, but also access to government information. Wanjiku talked about the capital to clinic tool, which is actually an action checklist of all the policy cycle, from the advocacy strategy, including the budget cycle, evidence generated, the policy adoption and implementation. So thank you so much, our panelists, for sharing these tools that can enhance accountability for policy and financial related commitments to MNCH, and also support policy implementation at all levels. What is clear is that there are quite a number of tools available that we can make use of as advocates. Commitment tracking will remain key as countries ramp up efforts to meet the 2030 targets. Decreasing investment in MNCH have been a critical barrier in accelerating progress. With the tools that we have been shared today, it is possible to successfully advocate for increased domestic investment in MNCH. The Capital to Clinic tool is an opportunity to successfully advocate for strong policies and ensure that they are implemented. I will now introduce the Menti session. With that, we have an opportunity to hear from you, our participants, using an interactive application. We are going to use Mentimeter. Kindly use your gadget and navigate on www.menti.com. The code is on the screen. Once you insert that code, it will take you directly to a page that has some questions for you to respond to. We would love to hear from you in terms of what is needed to move this advocacy agenda forward. and make sure of the tools that have been shared. But also we want to hear more about the additional tools you know that could be useful for this purpose. All this presentation will be shared after the meeting. Thank you. So let's go to the questions. We are supposed to have 10 minutes for that, but we only have 9 minutes left. Esther, what would be the plan?
Yeah, we can use 5 minutes to run through the questions and then we close.
Okay, thank you so much. From now on, for the first question, what support do you require to make more use of these tools that were presented today? We have 5 responses: sharing the tools with us, advocacy, the resources for us to review, more specific webinars on the tools. They talk about financial resources, full-time dedicated singularly focused staff are essential for successful advocacy. Develop some KP for different target audience. That was an excellent webinar. This is an evaluation, very useful. And learning visit. Someone raised learning visit also. I just need to understand how my organization can become an integral part of the process in the countries where we have presence. Also share tools with us. Thank you so much for sharing this idea. Could we go to the next question, please? What other advocacy and accountability tools, approaches, and processes have you utilized previously? One response is community scorecards, the AU Health Stats scorecard, community reports cards, citizen reports cards. Wow, seems that there are many materials for that. Facility audits, Global Countdown 2030, WHO guidelines, UNICEF and WHO data, community parliament, community-led monitoring tool. Wow, that is great. So we will stop we'll stop here the questions because we are short of time. I will hand over to Esther Nasikie, the Global MNCH and Immunization Advocacy Lead, who will share with us the next steps, as well as talking about briefly about our work related to advocacy brief. Thank you so much for your participation, for your active participation throughout this session.
Thank you. Thank you so much, Dr. Astor, for moderating this session excellently. Thank you so much to Dr. Aminu from Nigeria, who shared with us the tools on budget advocacy, and then the colleagues from PMNCH, ILS, who shared with us about the CAPS. Thank you so much. And my colleague Wanjiku, who summarized excellently the Capital Clinic tool. So just before we close the meeting, I have 3 other updates to share with us. First of all, we are in the process of developing advocacy briefs to support MNCH advocacy, not just at the country level, but also at the Africa regional level. And because of time, I'll not, maybe dive into the background and the justification for why we need advocacy briefs. But as advocates, you know that these are important tools to advance this work. And so why I am announcing this is because we need a task team that can work with us here at PATH to put together these resources. We are focusing on advocating about 6 advocacy briefs. One is going to be focused on the Africa region, and then the other is going to, the other tools are going to be very country specific. The countries of interest at the moment are Nigeria, Zambia, Uganda, Kenya, and Ethiopia. So the request is for partners and organizations that would like to partner with us to develop these advocacy tools. We are requesting you to send an email expressing your interest, basically an email raising your hand that demonstrates that your hand is raised to be part of this process. And let that email go to my colleague Pascaline Njau, who is leading that specific aspect of this role, but also supports country engagement, and will finally convene the team that will put this together. And rest assured, your organization will be recognized in terms of your logo being part of printed on the documents that will finally be printed out and disseminated. So we are requesting you to join that task team. And then the other update I want to share is that this was part 1 of this this meeting. So we are requesting and inviting everybody that was with us here today to join us next week on Wednesday. At the same time, we'll be sharing additional tools that advocates can use to advance MNCH advocacy, not just at the subnational level, the national level, but also at the regional and the global level. So please join us for part 2 of this dialogue. And then finally, but also most importantly, I really would love to appreciate our partners. If I can go back to the slide that was before that, I would like to appreciate our partners that have that were with us in the process of putting this together. So specifically, I want to appreciate the Africa Health Budget Network, represented by Dr. Minu. I also want to appreciate Align MNH/Japaigo, and we were thought partners with Charlene Reynolds, but also Angela Mutunga, and then Samasha Medical Foundation. We were, together with Cornelia Asimwe, and then PMNCH. You had a speaker today, but also you'll hear the other presenters next week, including Helen Scott, who has been a key thought partner in this process. I might have missed out maybe 1 or 2 partners, but I know I will be forgiven. So I just want to say a big thank you to the partners that helped us to put this together. And then also WHO has been critical in these conversations at the regional, but also at the global level, and we do appreciate them for that. So with that, I really want to thank everybody for joining us. Thank you so much to the participants that have stayed with us for the whole 90 minutes, also contributed your thoughts, your ideas, asked critical questions. The promise is that for questions that have not been responded to, we shall get the partners to respond to them, and we can include them in the materials and the meeting summary notes that will be coming your way after the meeting. But before I leave, I also want to appreciate my colleague and senior leader, Dr. Astu, who moderated this session. Thank you so much for doing an excellent job. So with that, I want to say thank you and wish you a good rest of your day. Thank you so much, and see you next week on Wednesday. We can leave the contact for the colleagues so that they can send the email for the development of the country advocacy briefs. Thank you so much, and bye everybody.
Bye-bye.